Hi, my name is Dr. Diana Londoño. I'm a board certified urologist in Los Angeles. And today we're going to talk about something very basic to urology, but really important. And that's a UTI, or a urinary tract infection. We're really going to talk about what it is, how it can present, what tests are needed, and really how to prevent it as well. And just get more information to understand it, because I think even though it's so common, sometimes it can be really misunderstood. So again, a UTI is short for urinary tract infection, that there's an infection somewhere along where the urine passes. And the symptoms that come with it are usually frequency to go, an urge to go, pain, a bad smell in the urine. It can also have blood at times. And if there's symptoms like a fever, 101, chills, nausea, or vomiting, this could be because now the infection has gone into the bloodstream and is now systemic. So not just localized perhaps to the bladder, but has traveled into the kidneys or the bloodstream. So how can we tell that there is an infection? Well, the symptoms are important, but then we have to check a urine analysis and a culture. And that's going to give us information to see if truly bacteria is in the urine. So we need 100,000 colonies to say that there are symptoms and there's bacteria to call it a UTI. Now, why is it important? Because the culture will tell us a whole list of antibiotics that either are sensitive, that will work, or are resistant, that won't work. So we need to make sure that whatever antibiotics are given, that they're the correct ones and they're not resistant. And maybe that's why you don't get better, because we don't have that information if it's not sent. Now, it's important to know that if you go to your doctor's office, to an urgent care, or even you can buy at-home dipsticks, these little sticks help us to see if there's something suggestive of an infection, but it does not diagnose it. So it's important to start off with a dipstick to see if truly there could be an infection, and then send out a urine analysis with a culture. Now, we'll talk a little bit about the dipstick just to get an idea of what that information gives us, and also an analysis, what it is telling us. So there's a lot of things that come with it. One of them is a color, which is obvious. So it's either light, yellow, or red if there's blood. And it's important to know that any dipstick, if you're on a medication like azo or pyridium, this will make everything orange, including the stick. So you can't really get a good reading on this, and it will have to be sent out to the lab to know if there's bacteria or not. So just remember, if you're on azo or pyridium, you won't get good information. Now, there's some things that we look at on the stick or in the urine analysis, something called leukocytes. And leukocytes are inflammatory cells that we see when there's any inflammation in the urine or in the blood. But here we're looking at urine. And if there's a bacteria that is causing this infection, it is very likely you could have leukocytes. So that helps us to know if we're going to send it out for culture and if this is a UTI. There's also something called nitrites. And the urine has nitrates from protein metabolism. So if bacteria is there that should not be in your urine, it can change the nitrate to nitrites. And that will then make us suspicious again that there could be an infection. So there's certain bacteria that make this change from nitrates to nitrites. Not all of them do, but usually E. coli, Enterobacter, Klebsiella, Serratia, Staph can do it. So not all of the bacteria do it, but most of them do. And so again, it can help us if we see nitrates, then this could be because bacteria is present. Now, we all live with the bacteria that's in our intestinal system, but sometimes it can get to places it shouldn't be, which is in the bladder, and it gives us those symptoms. There are other things on your dipstick that are there, but don't help us for infection's sake, but they're there. So I'll mention them quickly so you know what they're doing. Glucose just checks for a presence of sugar, and if you're diabetic and is not well controlled, it's going to show up in the urine as well. Protein If your kidneys are not working well, if they've told you have kidney disease, or your creatinine is elevated, sometimes we can see protein, but it's not diagnostic of anything. It's just we commonly can see it. Bilirubin is breakdown of the bile, and is usually seen with liver disease. But again, it doesn't help us for urine, but it's also checked. Ketones, if you are diabetic and you're breaking down fat instead of sugar, we can see ketones in the urine as well. And specific gravity tells us what is the dilution of the urine. And that can help us know if you're dehydrated or you're drinking enough water. And so if your specific gravity is low, it means you're very hydrated. And if it's very high, it means you need more water. An easy way to know this too is look at the color. Your urine should always be light like lemonade, because that tells us you're drinking a lot of water. As long as your heart and your kidneys are healthy and you can tolerate, all the water, you want to look at the color and see if you have been drinking enough water. So if it's dark yellow, it's amber, it's too dark, that means drink more water. Many times we drink a lot of water, but maybe we're exercising, or if there's diarrhea or you're sweating, you're outside, you're going to lose that water you drink, and it doesn't make it to your kidneys and your bladder to become pee. So make sure you always look at the color. That's an easy way to know. Another thing is that pH, and that's just the acidity. It doesn't help too much for UTI, but it can be very helpful in things such as kidney stone and kidney stone prevention to look at the acidity. But that'll also be on your urine test or on the dipstick. So when we have the symptoms I described and a positive culture, then that's a UTI. And for women that don't have some of the caveats I'm going to talk about, it really is considered an uncomplicated UTI. Now, there's something called a complicated UTI, and that is when a man, a child, somebody that's immunosuppressed, or somebody that is a woman that's pregnant, has kidney stones, blockage of the urinary tract, or they have spinal cord injury, or a stent or a catheter to drain the bladder, that becomes a complicated UTI. So this matters because that will help us to know the length of time that you should be treated with antibiotics. So if you're a woman and you have an uncomplicated UTI, 3 to 5 days is all you need. So many times I see women that didn't have any of these other reasons to make it a complicated UTI, and you get antibiotics for 10 to 14 days, and that's way too long. So again, if it's uncomplicated, 3 to 5 days should be all you need. Now, I want to talk about something that's really common as well. And this is something called asymptomatic bacteriuria. And that's a fancy name to say what it is saying, that there's no symptoms, but there's bacteria present. And this is really important because this does not have to be treated unless you're pregnant, unless you're going to have a surgery, usually of the urinary tract, or your surgeon's going to implant some hardware and they've told you that they need to have the urine clear of bacteria. Other than that, everybody else really does not need to have this bacteria treated because it's not a UTI. Remember, the definition of UTI is the symptoms and the positive culture. So many times my patients will tell me that they're told they had a UTI and they're called up and they give them antibiotics. Nobody can tell you you have a UTI. You have to tell us it hurts, it burns, you have frequency, smells bad, and all the symptoms we talked about, and then the culture confirms it. So if your doctor calls you have no symptoms, please call a urologist or get a referral so that we can help you and guide you, because many times you don't need treatment, again, unless other symptoms or reasons are present. We all live with bacteria and we don't have to get rid of it because we can live with it and it doesn't cause us problems. Especially in peri, which is around, or menopausal women, this is really common that we see this in the urine. And again, you don't have to have it treated unless the bacteria is causing symptoms. Okay. Nobody again can tell you you have a UTI. It's like saying, to somebody else telling you you have a headache, but you have to tell us my head hurts, my eyes feel blurry, or I'm sensitive to light, I feel nauseous, then the doctor can run more tests to confirm. And if they say this is a headache or a migraine, then they can give you medication for it. So it's the same for an infection. You have to tell us, and it has to be confirmed with that urine culture. So we want to, again, know what it is, a UTI, know that asymptomatic bacteria does not have to be treated. And I want to talk a little bit about prevention. So it varies with men or women. But if you're a woman, the most important thing you can do for prevention is drink water. And again, we talked about how much water we should drink. And the easy way is look at the color. It should be light like lemonade. Then we want to prevent constipation. Constipation is a very big cause of infections. So it's really important that you drink lots of water, yes, to prevent constipation, but also avoid constipation if the water is not enough. So you may have to add fruits and vegetables, and fruits like stone fruits, pears, peaches, plums, pears, anything with a P, papaya, that's going to help you to be regular. Blueberries also can be very helpful. And it's really important that you're on a pre or probiotic. There's many brands, but do the one that works for you or the one that's within your budget. Or also you could add daily yogurt, which has probiotics and calcium and can be just good for your digestion. If you are perimenopausal, around menopause, or menopausal, which means you have not had a period for 1 year, now you're in menopause, and there's going to be vaginal dryness happening, which is a huge risk for infections in menopausal women, and likely number one reason. So it's very safe to start topical on the surface of the entrance of the vulva estrogen cream to prevent UTI. I have a video about menopause and the changes that occur in the vulva and bladder, so please watch it to learn more about this because it's very safe for most women. And it's really important and the thing that will prevent infections. If you're a man, water intake and constipation are also very important, but it may be also important for you that you're emptying your bladder well. As men age, their prostate grows in size, and that growth can prevent the urine from flowing easily. And it may be hard to pee, or it's difficult to get the urine out. You have to push to get the urine out. And you may not be emptying your bladder as well as you like, and that can put you at risk for infections. So depending on, again, risk of not drinking enough water, being constipated, or having some anatomical problem like kidney stones or blockage or not emptying the bladder well, or a narrowing of the urethra, or many other things can cause the infections to happen. Also, if you had prior surgeries or radiation, these are things that, again, can put you at risk. So what's really important to do is to get a good physical exam so we can look at all your anatomy. Make sure you're emptying your bladder well. So we'll check with something called a post-void residual, an ultrasound after you pee. And many times, either an ultrasound or a CT scan may be needed depending on your history, and a cystoscopy, which is to look with a camera inside your bladder. I also have a video about cystoscopy and explaining what we're looking for and how this is done, so check that out as well. So remember, a UTI means that you have symptoms and a culture that proves it. And if you're a woman that's had more than 3 to 4 a year, or you have kidney stones or blockage, or your bladder has fallen, prolapse, or you're a man and not emptying well, and definitely if you're a man with an infection, you need to see a urologist. This is never normal, and you need further tests to make sure you're safe. Urinary tract infections can be easily treated and prevented, but they can also make you very sick and end up in the ICU. So it's really important that you prevent, that you treat appropriately, and that you seek care. I hope this was useful for you. To learn more about UTIs, check out the other videos if you had questions about cystoscopies or other procedures or blood in the urine. Thank you again, and remember, share this if this was helpful for you, and we'll see you next time.